So welcome to today's virtual careers talk with Samantha and Laura, who are two of our fantastic physiotherapists. So I'm going to be recording this session, so we ask you to keep your microphones and cameras off. If you want to ask any questions, either pop your hands up or you can type in the chat box and I'll relay them. So welcome, and I'll hand over to Samantha and Laura.
Hi, my name's Sam.
Hi, I'm Laura.
And we're both physios at Salford Royal. We are currently on a respiratory rotation. So we're both band 5s, and I've been a band 5 for kind of 4 years-ish.
Yeah, I've been a band 5 for 2 years this coming September. I think we both had a variety of experiences really in both acute and the community. I think I got into physio really straight from college. I think like a lot of physios, I had a big interest in sport, which sparked my interest, and it was only when I had an injury myself and I met a physio for the first time that it sparked that kind of passion. I loved how much they knew, I loved how empowered they made me feel, and I loved that it wasn't just after I had an injury, they actually kept me on and were doing preventative measures for the future. And I just felt like that was something that really inspired me to continue and progress to make this a profession.
My experience is kind of a little bit different. So I initially went to university to do a different degree. So I did a media degree for 3 years. Didn't really know what I wanted to do with that degree. Went travelling for kind of a year and a bit to try and figure out what I wanted to do. And in that time, my nana actually had a heart attack. And as I come back, I kind of followed her journey through it, watching how the physio kind of gave her that kind of confidence to go from bed to chair to actually doing her own shopping and getting out into the community a bit more. So that kind of, I saw it from a different side to Laura. So I went back to university, but I initially had to do a distance learning course. So I was working on a night during the day and then doing the course in the night time to kind of get the stuff that I needed to be able to get into uni. So I did 3 years at uni at Manchester Met University, and we do kind of a variety of placements, don't we? So kind of about 5 placements, about 1,000 hours that we need to be able to complete clinically, as well as doing kind of and exams in our first, second and third year, and they're both kind of practical and written exams. And then with a variety of different placements. So I kind of spent a bit of time in the community, in MSK outpatients, and on the wards. What was yours like?
I was in a variety of placements as well, really. I think I kind of got what we generalise as the core areas, so musculoskeletal practice, community, neurology. I was in a stroke placement, which was really enjoyable. And then I was in elderly and the emergency assessment unit as well, trying to see if we could get people home as quickly and as safely as possible. And I think kind of whatever area you're in, physio is brilliant for finding meaning, what matters to these patients and how can we help them fulfill these goals. And I think that's something that really draws us in.
So I've been at Salford for kind of 2 years, so I was at a different trust before that, but here at Salford I've kind of done stroke, rehab, neurosurgery, so anyone that's had any bleeds on the brain, any tumours, brain tumours, things like that. I've done respiratory, I've been into the community as well, so there's kind of a variety of stuff in and outside of the hospital, to be able to kind of see those different diagnosis and kind of follow that journey. So at the moment we're up on critical care, aren't we? So we kind of see the patients that are extremely unwell, and I've seen that kind of journey from extremely unwell kind of into kind of the acute setting, but they're a little bit more stable.
We kind of follow them on with their journey, which is really nice and rewarding to see, I think.
Yeah, and then into the community, so that's quite nice. Kind of our day-to-day is, I mean, it differs day to day really. So we come in the morning, we screen our wards. So there's two sides to our team. There's a medical and a surgical side, and we're both on the medical team. So that's anything that's kind of emergency stuff that's come in. So anyone that's got any respiratory distress, any kind of traumas, COVID, which is kind of the big thing at the moment. What else do we see? Any asthma attacks. So we will come in the morning, screen the wards that we work on. So heart care, the urology wards, and any high dependency. And then we'll go up to critical care and kind of see those patients that are on ventilators and kind of try and clear their chest to make sure they're not becoming any worse with their chest. And then we will kind of, as they start to become a little bit better, we'll try and get them out. So some patients, we can stand them quite easily, can't we? Get them in a chair and kind of work from there. Other people who have been on a ventilator for kind of weeks, months, are extremely weak. So we kind of work with them, give them some exercises, make sure that we can look at their movements, and then kind of transfer them and look at different ways in which we can transfer them to be able for them to sit out, because ultimately you don't lay in bed all day, do you? Kind of doing nothing.
Yeah, it's just promoting that normality really. I think one of the major skills you kind of learn as being a physio is being very methodical with your approach, being able to analyse the different situations that bring people to hospital, finding out their goals and what's meaningful to them, and trying to tailor our treatment using our critical thinking skills to kind of adapt our sessions to suit them.
Yeah, and we kind of use SMART goals as well. So it's not all about just getting somebody up and getting them in a chair. It's about what that patient's goals are in what they want to achieve. So for somebody that's elderly, it might be that they want to be able to get out of bed themselves and kind of potter around, whereas a young 20-year-old, for instance, that's not their main goal. Their main goal is to be going out and doing things that they would have been doing before they've come into hospital. So it's about looking at those goals, and everyone's an individual, and everyone has different goals and different things that they want to achieve, and that's what I think is kind of the good thing about being a physio. Would you agree?
And I think, just to add on to that, another skill that we have to use daily is our communication skills, being able to use a variety of verbal and non-verbal techniques to speak to a variety of people really who may have different levels of understanding of what's actually going on. So obviously you have the patient themselves, you may have to discuss things with their family, we may need to speak to the medical team or the nursing staff, see how the patient is getting on from their point of view. And I think that's something you can really build on being a physio.
Yeah, it's not working as a lone worker, is it? It's involving everybody. So having that skill to be able to talk to your colleagues, but also talk to patients, to be able to get the best out of everybody, to be able to take that patient and get them home essentially, or wherever they want to be.
And being able to do it in a timely manner really. I think time management is a big part of what we do, because we have a variety of people on a fair few wards we have to cover, and we've got to keep on top of our caseload. And I think that's a great skill to develop both inside and outside of work.
Yeah. I think kind of our things that we were talking about earlier, weren't we, about what we've learned and what we would kind of give our advice to is kind of having a bit of resilience and not taking yourself too seriously in this job, I think, because at the moment, obviously with the pandemic that's happened, it's been quite difficult, hasn't it, at times, having to watch people who are extremely unwell, and having to kind of deal with that, not just on one patient, it's on every patient that you go to. Coming out of that and being able to kind of have a bit of a, you know, a good relationship with your team and being supportive and having a bit of a laugh helps with to be able to kind of cope with all of that, I think.
Yeah, I think it's, in terms of resilience, it's appreciating that people have different values, different priorities maybe compared to us, but at the end of the day we all have the same goal, which is essentially good quality patient care. Yeah, I think that's probably one of the key traits to going into this kind of job, is to have resilience, having confidence in yourself.
Yeah.
And probably just being able to, like Sam said, not take yourself too seriously and learn to enjoy the little things, the little joys in life, the little improvements you see every day from people. It's so rewarding.
And I think every person is different and every journey is different, and seeing those small little changes in people, I think, is probably the best thing.
Yeah.
That we deal with a lot of patients that have got tracheostomies in, so, and they're not able to communicate very well, are they, most of the time. So being able to kind of give them a voice and for them to be able to express that they need something is a massive, like, difference in their treatment.
Yeah, again, being able to speak to your family after you've been really poorly and you finally get that voice again, it's really empowering.
Yeah.
And I'm glad we kind of have the ability to get involved in that.
Yeah. I think that's kind of what we wanted to say.
Yeah.
Does anybody have any questions?
Thank you, you two. Very interesting. Has anyone got any questions that they'd like to ask? You can either type in the chat box, or if you want to put your hand up, feel free to do so. I'll ask a question, see no one's come forward as yet. Is the physio role how you expected it before you became a physio, or is it different to what you expected?
I think that it's not totally opposite to what I was expecting, because we have to get into a physio course, they generally like you to have a bit of work experience in both a hospital and private sector.
Yeah.
But I will say that physio continues to evolve and change in my mind to what I expect it to be. And to be honest, most of it's been in a positive way. I can't really think of a negative, but I would say that it's given me the ability to be able to move with the change and accept that change isn't necessarily a bad thing.
Yeah, I think you kind of, as a student, you focus really on seeing a patient and what's wrong and what's going on, whereas as a qualified member of staff, you've got to think about kind of everything. So that multidisciplinary team, so the doctors, the nurses, the occupational therapists, what goes on in the community, what's your team like during the day, how much staffing have you got, things like that you don't really ever think about initially, do you? So I think that bit of it is different. But yeah, like Laura said, kind of knowing what you're kind of doing is kind of the same bit. But yeah. It surprises me sometimes, but it's a good surprise, I think.
And I mean, I think that's the nice bit about being a physiotherapist. You're an autonomous practitioner. So essentially that means that you are in charge and have the ability to determine your treatment path for people. And I think that's something that isn't unique to our profession, but I wouldn't say every other profession gets to work in this way. So it's really rewarding.
Yeah, I mean, you've got to think of things that are sometimes out of the box a little bit to kind of get people to engage. I mean, I've been to see a patient who loved to salsa dance. So, I mean, we were salsa dancing up and down the ward, which is something that's kind of unique from that experience. So, and then the next patient was an elderly woman who wanted to get to the chair. So you kind of have that massive difference in kind of patients, which is quite fun, really, I think.
Yeah.
Brilliant. So Abby asks, what do you think is the best way to prepare for a career in physio or starting a university course in physio, especially coming from a non-physiotherapy background like your media course?
I would say the best thing to do is try and get some experience anywhere, whether it's in a hospital, in the community, anywhere that does physiotherapy. Ring them up, email them, ask them if you can just even do like a day, just to see what it's like, because I kind of knew what it was like, but I think going into it as a student was different to what I thought it would be initially. So I think just getting that experience and understanding and knowing what it is going to be like is the best thing to start and prepare yourself for that, really. I think, do you agree?
Yeah, I agree. I think experience is key. I wouldn't worry too much about feeling you have to learn anything prior to your course starting necessarily, because once you get into a university course, the tutors do direct you with that kind of self-learning progress. So I don't think you have to go into it. They're not expecting you to go into the physio uni interviews knowing everything.
Yeah.
It's just kind of showing you're compassionate, you're into what you're doing, you have knowledge of the different areas within the physio world.
Yeah.
Thank you.